Bismillahirrahmanirrahim. Assalamu alaikum students. Today we will be discussing an important pathophysiological phenomena, that is septic shock. Students, before going into the details of septic shock, let us see what is sepsis. Sepsis is defined as response of the human body to any type of infection. I repeat, sepsis is response of human body to any infection. This infection may be because of bacteria, viruses, or even fungi. Students, septic shock has following steps to develop. First of all, there is sepsis in the body, which means presence of infection. Sepsis means presence of infection with clinical signs and symptoms. Okay, students? Now this sepsis converts into severe sepsis. Means there is infection as well as organ dysfunction. This infection may involve kidneys. Infection may proceed to lungs, or infection may proceed to involve any organ of the body. This severe sepsis then leads to septic shock. Students, severe sepsis leads to septic shock. Now, what is septic shock? Students, septic shock is a clinical condition which is characterized by infection, multiple organ dysfunction, hypotension, decreased blood pressure, and fever. I repeat, septic shock is defined as a clinical state which involves infection, multiple organs of the body, characterized by decreased blood pressure and fever. Students, in most of the cases, septic shock is mediated by endotoxins. As you know, endotoxins are toxic molecules which are part of cell wall of gram-negative bacteria. Okay, students, now what is the mechanism of endotoxin which leads to septic shock? First of all, endotoxin, they activates the macrophages. Macrophages causes increased production of interleukin 1, and interleukin 1 is responsible for fever. Second, macrophages, they produce tumor necrosing factor. Tumor necrosis factor, it causes fever and hypotension. Thirdly, macrophages, they produce nitric oxide, and this nitric oxide leads to hypotension or decreased blood pressure. Students, second mechanism is activation of complement system. Endotoxin, they activate the complement system of the immune response, especially C3A, C5A. Students, C3A causes hypotension and generalized edema. C5A leads to increased deposition of neutrophils at the site of infection. Third mechanism of endotoxin is endotoxin. They activate tissue factor, and this tissue factor leads to increased coagulation capacity in the blood, which is called DIC, disseminated intravascular coagulation. So students, we can brief the mechanism of endotoxin, that endotoxin activates macrophages. Macrophages leads to interleukin 1 production, TNF alpha production and nitric oxide production. These three leads to fever and hypotension. Second mechanism, through complement activation, C3A and C5A. Thirdly, activation of tissue factor, which leads to DIC. So, to conclude the things, students, we can say that septic shock is characterized by infection, organ involvement, hypotension and fever. The mechanism behind septic shock is endotoxin production, and this is the pathophysiology of endotoxin production. Please take a detailed look of this lecture. Thank you students. Allah Hafiz.